But of course, because of the restricted time, I'll try to summarize as much as I can. And before we start, we have to know what are the levels of relationship between the medical school and the society. So the first level is social responsibility. And this means that the medical school is aware of the needs of the society. So this is the first level. The second level is social responsiveness, and this means that the medical school is responding to the needs of the community by incorporating some of the community-based activities in its educational program. And then the highest level is the social accountability. So what is the definition of social accountability? The definition as defined by WHO in 1995 is the obligation of the medical schools to direct their education, research, and service activities toward addressing the priority health concerns of the community, region, and or nation they have mandate to serve. The main challenge for the medical school was to become more effective in training physicians. But in the 21st century, the medical schools presented with a different set of challenges. What are these challenges? First, the education and health services should be of quality. There should be equity in providing the services, and in the education, they should be relevant to the needs of the community. There should be effectiveness in healthcare delivery. The medical school should reduce the mismatch with the societal priorities and provide evidence of its impact on the people's health and redefine the roles of health professionals. So for all these challenges, the medical school has to change its aims. So to address these challenges, 130 organizations and individuals all over the world who are responsible for health education, professional regulation, and policy making, these peoples with a group of 20 international experts as a steering committee who are medical educators, specialists in accreditation and social accountability. All those persons meet and entered in 3 stages of Delphi technique. And at the end of this Delphi technique, I'm sure all of you know this Delphi technique. There's no time to define. I'm sure you know all. You are experts in medical education. And they came up at the end with 3 open-ended questions. What are these open questions? The first is, how should a medical school improve its capacity to respond to future health challenges in society? The second, how could this capacity be enhanced, including the use of accreditation system for self-assessment and peer review, and how should progress toward this end be assessed? So these 3 questions come up from this group. Then they collected responses over 8 months for these 3 social accountability. For a medical school to be socially accountable, it should match with these 10 areas. Under each area, there are sub-areas, and it comes for 43 sub-areas. Because of the time being, I'll try to summarize each area in brief. So the first area is that the medical school should anticipate society's health needs. What are the sub-areas here? The first is that the medical school development at the beginning of the start of its development should be guided by relevance, equity, quality, responsible application of resources, sustainability, partnership, and innovation. And then it should direct this to the education, research, and services accordingly. Another sub-area is that the vision and mission of the school should include the community, should spell the community needs. Then the area 2 is the medical school should partner with the health system and the other stakeholders. So the medical school with its stakeholders who are, should partner with stakeholders who are all stakeholders involved in the health policy makers, governance, Ministry of Health, or other professional health professional school. Everyone involved in health should partner, the medical school should partner with. The most important partner is the local community. This is very important. And the medical school with the professional organization should share in advising healthcare authorities for more social tertiary levels of care. So come to the area 3, adapting to the evolving roles of doctors and other health professionals. The roles of health professionals are changing now. So the first sub-area here is the medical school with its stakeholders should define the graduate competencies. And these graduate competencies should be consistent with the evolving community, the health system they work in, and the citizens' expectation. Of course, the graduate competencies, as all speakers said before, should include most important things like professionalism, ethics, teamwork, leadership, communication, cultural competence, and whatever you. This is very important to be defined. Still in area 3, the medical school undergraduate education, postgraduate education, continuous medical education should produce a variety of specialists appropriate for inequality and quantity. The medical school should again foster the graduates committed to primary health care. And lastly, in this area, the future doctors, regardless of specialty, should be active in population health promotion, as well as risk and disease prevention and rehabilitation, that this should be introduced and be integrated in the undergraduate curriculum in a very good way. Then the area 4 is to foster outcome-based education, and this is very easily. The curriculum should meet individual and societal needs. I'm sure all medical school can do that easily. Bring learning opportunities and facilities for lifelong learning for the student. Do periodic update of your educational strategies. Select and support students for social diversity and disadvantage. Of course, this may not be relevant to your country, I'm not sure, but it is not relevant to my country because we have a central selection and the distribution of students. So some schools, if they not have this system, they should select some student of social diversity and disadvantaged students. Then you should regularly assess the competence of your students, and then you should have early and longitudinal community-based education. Community-based education should be done very early, from the beginning of the educational program, and should be done all through the 5 years or the 6 year of the program. Besides, social accountability capacity building should be done for your faculty members to know what is social accountability, and also for the students. The area 5 is to create responsive and responsible governance of a medical school. How we do that? The medical school should have a responsible leadership which can integrate social accountability concepts in the education, research, and services. The medical school should define the health needs in collaboration with the student bodies and the academics. All of them should share. The medical school should partner with other health profession schools. You know that now the interprofessional education is a very important topic now all over the world, and you should partner with other health professional schools to enhance this area, and then to ensure appropriate allocation of resources. Area 6 is to refine the scope of standards for education, research, and service delivery. First, by deployment and retention of graduates where they are most needed. Of course, this is not the responsibility of the school. So there should be some negotiation with the other sectors to reach to this. Develop graduate capacity to efficiently address priority health issues, and this is, of course, the main issue of the school. Conducive working environment for graduates, and this, of course, also is not the responsibility of the school. That's why you should always do some collaboration with other sectors. And the last one in this area is contribution to health status improvement of the general population where the medical school is embedded. Social accountability, and faculty and the students should be included, and because they are key players of the social accountability in the school. Area 8 is very easy because it is establishing mandated mechanism for accreditation, and this is the responsibility of the accreditation agents. Area 9 is to balance the global principles with the context speciality. As Dr. Janet said, there should be anything you should adapt to your context. Medical school should integrate international, intercultural, and global perspective in education for mobility of doctors, and global concepts of social accountability should be adapted to the local context, as I said before. It is very important to adapt it to your local context. Don't take it as it is. You can adapt it very easily from what I've said. The last area is defining the role of society, and there should be a balance between the institutional autonomy and the role of society. Don't let the society to be too much introduced in your system to keep your autonomy. And then stakeholders should be involved in the reviewing process. And finally, community should be regularly surveyed for the level of social accountability of the school. To see your impact as a school, you have to have a geographical area to measure this, your impact on the, in this area. And so finally, the social accountable medical school should respond to the community needs and the challenges, should direct its education, research, and services accordingly, should strengthen governance and partnership, and assess its performance and the impact using accreditation standards. The final slide, to enhance social accountability, you need to disseminate the concepts of social accountability to all stakeholders, especially policymakers. Guidelines should be agreed upon by all involved in the social accountability initiative. Medical school and Ministry of Health should collaborate to enhance social accountability. A geographical area should be defined for each medical school to measure its impact on social accountability. So you will not see your impact on all Kolachi, for example. You can select a geographical area and measure your impact on it. Accreditation authorities should emphasize social accountability in their standards, and now there is a group, the faculties of medicine in Canada, who now is doing, trying to introduce the social accountability concepts in the accreditation standards, and I have the honor to be the coordinator of the standard setting group with very prestigious person like Charles Bolin and other people. We try to do this process, inshallah. Then research on drivers of social accountability should be encouraged, and government should support and coordinate the effort of different parts to enhance social accountability. This is my reference, and thank you. I'm sorry if I miss my time.
Thank you very much, Professor Sumaya.